It's my pleasure now to introduce John Holmes. He's from the Sheffield Addictions Research Group of the School of Medicine and Population Health of the University of Sheffield. And John, how effective are these low-risk drinking guidelines now? So looking forward to your presentation.
Okay, so thank you for inviting me to speak today. I'm going to talk about the evidence on the effectiveness of low-risk drinking guidelines, and particularly our experiences with those guidelines in the UK. So as many of you will know, and has kind of been said already, drinking guidelines have proliferated internationally since the 1980s, and health authorities in most high-income countries now issue guidelines for alcohol consumption. But despite them being a fairly commonplace public health intervention, there's little evidence available on their impact or their effectiveness for tackling alcohol as a public health problem. And just to warn Emily, don't worry, I'm not going to talk all over your topic. The evidence we do have typically comes from one-off surveys and shows that people are aware of guidelines and they know what the guideline is to a certain extent, particularly where there's been a mass media campaign to promote it. But there's much less evidence that this awareness and knowledge actually translates into drinking behaviour. There's studies here and there, but not a huge amount of evidence. Evidence from focus groups, meanwhile, suggests that people often disregard drinking guidelines, as they find them difficult to apply to their own drinking behaviour, which often involves drinking at much higher levels than those that are recommended by the guideline. Guidelines also require people to understand standard drinks or units, which many people don't. So instead, people tend to monitor their drinking and their levels of consumption by embodied feelings. So they limit their drinking based on how intoxicated they feel, or based on their previous experiences with alcohol and its after effects, such as hangovers. There's a separate literature on alcohol health warning labels, which is relevant here as well, because one of the main ways that people find out about alcohol drinking guidelines is through product labels. However, as with guidelines in general, the evidence on health warning labels suggests that they can influence awareness and knowledge, but there's much less evidence that that translates into changes in behaviour. So there's little evidence to suggest that promoting low-risk drinking guidelines on its own is an effective public health strategy. But some people have argued that guidelines may be useful as part of a wider public health approach to alcohol. And this is because they can help to shape social norms or cultural norms around drinking, and also build up people's understanding of alcohol-related health risks. In turn, and obviously that's important from a consumer rights perspective, but it can also help to underpin support for alcohol policies that might be more effective, such as pricing and availability and marketing policies. So there's still a positive case to be made for drinking guidelines. Turning now to the UK experience. So the government announced a review of its drinking guidelines in 2012 as part of a wider alcohol strategy. And this was generally seen as a good thing. The previous guidelines dated back to the mid-1990s, and the evidence on alcohol-related health risks, particularly relating to cardiovascular disease and to cancer, had changed quite substantially since then. The review began in 2013, and it was actually led by Mark Pettigrew, who we're going to hear from later. And its findings and recommendations were eventually published in January 2016. And the main new guideline recommended that drinkers could keep their risks from alcohol to a low level by not drinking more than 14 units per week for men or women. Now remember, as Catherine said, UK units are quite small, they're just 8 grams of alcohol. So 14 units is 112 grams, which is roughly equivalent to 3 litres or 6 pints of beer, or if you prefer, a bottle and a half of wine or 350 millilitres of whiskey. Now, these guidelines included 3 main changes from a previous 1995 guidance, which you can also see on the slide. Firstly, they changed the guideline from a daily guideline to a weekly guideline, to avoid implying that people should drink alcohol every day. Secondly, they reduced the guideline for men from what was effectively 21 units, and often presented as 21 units, to just 14 units. And finally, in doing so, they set the guideline at the same level for men and women for the first time. So what happened next? Well, the proposed guidelines were put out for public consultation in January 2016, although they weren't actually formally adopted by the government until August of 2016. But it is that January announcement that is effectively the date on which most of the promotion happened. And there are several things to note about that promotion. Firstly, the Department of Health published the proposed guidelines alongside a separate report on the on the evidence relating to alcohol and cancer. And that report particularly highlighted the small risks of cancer associated with drinking at low consumption levels. And this meant a lot of the media reporting emphasised that no safe level of drinking for cancer message, even though that message wasn't part of the guidelines and actually kind of conflicts with the idea that people can drink up to 14 units per week. So there was a bit of a contradiction in the messaging. Secondly, the Chief Medical Officer, Professor Dame Sally Davies, gave a series of media interviews and appeared in front of a committee of MPs making a number of headline-grabbing statements. So this included telling MPs that people should do as I do when reaching for a drink and ask themselves, do I want my glass of wine or do I want to raise my risk of breast cancer? And many viewed these statements as a bit unhelpful and as contributing to a sense that the new guidelines were more alarmist and restrictive than they actually were. Perhaps unsurprisingly, the committee that developed the guidelines later expressed its disappointment at some elements of the media launch. However, there was a sense that some damage had already been done. So the emphasis on cancer, and particularly the no safe level message, had really infuriated the alcohol industry, and that's perhaps not surprising. But there were rumours that the trade bodies had been marching into 10 Downing Street and threatening to withdraw from working with the government on alcohol policy. The industry responsibility body, the Portman Group, also removed its recommendations for members to include the drinking guidelines on product labels. More consequentially, it also quickly became apparent that the government wasn't going to be launching or commissioning a large-scale campaign through mass media to promote the drinking guidelines beyond that initial media launch. This all meant that when we came to evaluate the guidelines, it was effectively the media launch that we were evaluating, as there was no other substantial promotional activity. So, onto our study. Our evaluation collected monthly survey data using the Alcohol Toolkit study, which is a monthly, long-running, repeat cross-sectional survey of adults living in England. We then analysed these data as an interrupted time series, with the announcement of the new guidelines in January 2016 as the intervention point. Now, unfortunately, for funding reasons, we were only able to include questions on the drinking guidelines from November 2015 onwards, so we just had 2 months of data before the announcement. The questions did continue, though, until October 2017, so we had quite a lot of monthly post-intervention data. And the questions covered people's awareness of and knowledge of and exposure to the guidelines, and they also explored people's capability, opportunity, and motivations to change their drinking behaviour, drawing on the COM-B model of behaviour change. Alongside the shorter time series, we did also have data on alcohol consumption, though, stretching back to February 2014. And this was actually data on risky drinking using the Audit C questionnaire, which some of you will be familiar with. So, onto the results. So, using these data, we found that there were few substantial or sustained changes in any of the outcomes following the announcement of a revised drinking guidelines. So the line at the top is people's awareness of guidelines, which was high before the guidelines were announced at around 85%, and it didn't really change after they were announced. The proportion of people able to correctly identify the guideline increased by around 10 percentage points. That's the dotted line, just slightly lower down. But this increase rapidly dissipated and had returned to pre-intervention levels by the end of our data period in October 2017. In line with this, people were exposed to the guidelines, and we saw a sharp increase of the proportion of people who had correctly identified the guideline and reported seeing it in the previous month. And this was driven largely by TV and radio, so it suggests people were mostly seeing the guideline through news reports rather than anything else. But again, this exposure tailed off and was back to pre-intervention levels by October 2017. Now, I could keep showing you graphs like this for all of our other measures, but they largely all tell the same story. None of our measures of capability, opportunity, or motivations to change behaviour changed in any meaningful or sustained way after the announcement of the proposed new guidelines. Turning to our main outcome, though, we did actually see a significant change in alcohol consumption. So people's average audit C scores, they didn't change immediately when the guidelines were announced, but we did see a change in the trend. So whereas risky drinking had been declining before the new guidelines were announced, it actually started to go up after the guidelines were announced. Now, that was obviously worrying and the opposite of what we'd expected, but it turned out not to be robust in our sensitivity analyses. So what actually happened was that trend had changed 6 months before the guidelines were announced. And when we looked at other outcomes, such as tax receipts, which is a measure of alcohol sales, or hospitalizations relating to alcohol, we found no evidence that any of those things had changed. If you want to read more about this, it's all in our paper that you can see here. But the key thing to say is none of these negative or null results are particularly surprising. If you announce new guidelines but don't promote them beyond a media launch, we wouldn't really expect to see a lasting impact on knowledge or awareness or anything like that, let alone a change in behaviour, which is much harder to achieve. Before I turn to the lessons we can learn from this, though, I do want to briefly mention an analysis we did of the news reporting around the drinking guidelines. And I don't have time to go into the detail of this, so I'll just briefly summarise. So, firstly, drinking guidelines were continuously and routinely mentioned in news reports, kind of as incidental background information. And that's really important because this kind of background hum of repetition of the guidelines is one of the key ways that they're actually communicated to the public. Secondly, most of the mentions of the guidelines around the launch were actually fairly neutral and factual, so just news reporting. But there was a long tail of kind of critical commentary that went on for around 6 months afterwards. This criticised the scientific basis of the guidelines. It talked about the integrity of the process. It suggested there was a malign public health agenda. And perhaps most importantly, was it talked about the perceived inconsistency of public health advice around alcohol and other behaviours. And what particularly struck me was that although we would expect public health interventions to be criticised by some groups, public health actors often fed into this criticism. So a good example of that is this no safe level message, which people saw as conflicting with the evidence on the guidelines, and also kind of as much more restrictive than the guidelines were actually intending to be. Another example is kind of the continuous repetition of lots of epidemiological findings that alcohol either protects or causes against health conditions. And again, this just created a confused and confusing debate that allowed people to say, well, you can basically disregard health advice because it's always changing. And a lot of this, though, crucially was coming from public health actors. It was public health actors who were creating that circumstance. So, what lessons can we learn from this? Obviously, if you want new guidelines to change anything, your promotional efforts need to extend beyond just a media launch. Secondly, public health actors need to be cautious not to give mixed messages. And I've talked a little bit about what that means. Finally, there remains little evidence that promoting drinking guidelines in general is likely to substantially reduce the burden of harm from alcohol. But they are important tools for shaping norms and for informing people, and they may be important as part of a wider alcohol control strategy. So I'll finish there, just acknowledge our funders and my co-authors, and if you want to contact me, you can contact me here. Thank you.